All right, I thought I was last. I guess I'm not. Secretary Kennedy, thank you very much. His bold words tonight reflect a deep passion that he's expressed since very early in this administration, and it represents why HHS needs to be in the forefront of issues like this. The white paper that was crafted, it's several hundred pages long, but is actually a superb document, created a foundation for CMS, my agency, Medicare and Medicaid, to take bold action as well to address some of the challenges. But I want to take a second and outline where we are right now. There's an op-ed that Steph Carlton, my chief of staff, was over here somewhere, and I penned that just issued while we've been sitting here, and it highlights some of these issues. But of course, it all came out of the executive order of the president protecting children from chemical and surgical mutilation. Simple title, descriptive and accurate in its desire to do just that. And today we will deliver that to the president and to the secretary. Many of you, as you walked through the front portal of this building, the Hubert Humphrey building, saw Senator Humphrey's quote on the side wall. And he speaks about the moral obligation of government to take care of those at the dawn of life, our children. 53% of children in America are in Medicaid or CHIP programs. So we provide insurance to most children, and commercial insurance follow us. But we are in a weird place in America where we have mixed politics and medicine. And do you know what you get when you mix politics and medicine? Politics. There is no medicine left. We witnessed that with bizarre statements, predatory actions, and many other activities that I think have forced children to the tip of the spear where they have brunt the burden of this toxic combination. We've been told that permanently altering bodies of children, and the children are told this as well, will bring them lasting peace. But few have achieved the inner peace promised by these charlatans, and the talking heads, the media personalities, the social media posts, all these have created a dishonest narrative. And of course, many of these children are left with the most tragic parts of all the treatments that they've succumbed themselves to. Many physicians as well have been pressured into compliance. The white paper outlines this, with the dangerous progressive ideology that treats children like lab mice. And because often in medical school you're taught to go along to get along, they have not been willing to rear their heads and bravely say what they know to be right, which is that these procedures are wrong. Individuals who question their sexuality are treated by medical professionals on the fast track, that's what it's called, approach to care, resulting in drastic interventions that merely increase the distress they're already suffering from. Under politicized medicine, people suffer long-term consequences. Let me go through the three major categories. Puberty blockers, reduce bone density, alter brain development, which is a real problem when you're 11, 12, 13 years of age, and disrupt sexual function for the rest of your life, oftentimes. Cross-sex hormones cause irreversible changes, including infertility, loss of sexual function, even cardiovascular issues, as well as long-term endocrine problems. And of course, the surgical interventions where you remove healthy organs, despicable and reprehensible as it is, permanently alter appearances and destroy children's lives. So let's talk a moment right now about the big question. This dangerous fast-track approach in invasive treatment, what it really does is slap a Band-Aid on a much deeper pathology, a much deeper problem, the underlying issue of gender dysphoria. It denies patients the opportunity to be seen for who they really are. The doctor can't look them in the eyes and treat them like a child that's confused and lost and needs help. They become an opportunity. They become eventually a victim. Reasonable evidence-based objections that a child's confusion might resolve over time have been ignored, even though it makes common sense, and it turns out from numerous studies now in Europe to be true. Again, we outlined these in the op-ed. And this is not how clinicians respond to the care of other pediatric issues, but it's how we respond to pediatric adolescent mental distress. And the medically honest approach is to at least start slowly, the least invasive possible, psychotherapy, counseling, including family counseling, evaluation of other conditions like ADHD and autism, and of course treatment of the anxiety and depression that so often is included with this diagnosis. There's lots of reasons we're having this problem. Social media is obviously a concern. There's been an explosion of discussions within children's groups about these topics. The surge has also been accompanied by healthcare professionals advocating that there's not going to be any opportunity to push a child to think twice about the decision they might have wandered into mistakenly in a whimsical moment. And 57% increase in suicide rates over the last great data we have, which is from the teens, is also a concern. with teenage children bearing the brunt of this. American taxpayers should not have to foot the bill for ideologically driven experiments on our nation's youth, and hospitals that we deem must meet the minimum quality standards of care and safety should not be conducting these experiments when we know so little about what is happening with our youth. Now the important part. For these reasons, and I can go on and on, this document, the white paper that the Secretary commissioned is over 300 pages long, we're taking major steps at CMS to stop a funding process that has led to irreversible medical interventions with two major actions. The first, we're announcing a notice of proposed rulemaking that ends taxpayer funding of sex-rejecting procedures for children in Medicaid and CHIP, full stop. We don't provide health care to every child, but at 53%, we've got most, and we're not going to let taxpayer money go to hurt these children, and those children will no longer be hurt with this ideology. We know that inflicting these procedures on young people costs them and the Medicaid system countless dollars, not just in medical bills, but also all kinds of downstream issues, while providers reap the rewards. Too many providers inappropriately profit from carrying out these destructive procedures, and I'm just going to go through this grotesque laundry list of prices just so you're on the same page with what Secretary Kennedy started teasing at. According to a 2022 JAMA data, so it's very recent, the typical vaginoplasty, a procedure a child does not need, costs $60,000. Shockingly, a phalloplasty, the creation of a penis, costs on average in America, according to this data, high quality, $150,000 per child. I do believe, with doing some work, that these prices have continued to increase with increasing manufactured demand. And I must point out that the creation of a vagina, in that case of a phalloplasty, or a scrotoplasty where you add testicles, that's extra. This is a pathology that has afflicted the medical profession. It is shameful that clinicians have profiteered off this. I do not understand how it could possibly have been tolerated by the leadership of these institutions, but it will no longer be funded. And I can tell you, if they're so diehard desirous of helping children and they don't get paid, the question is, will they do these procedures? And I think we know the answer. The second big thing, that's $250 million over the next decade of savings to the taxpayer, but that's irrelevant to this issue compared to the harm to the next generation, to our future, because kids are always our future. Second, to reinforce the need to protect our children, we are announcing that certified Medicare and Medicaid hospitals, pretty much everyone in the hospital in the country, will no longer be permitted to perform certain sex-rejecting procedures on children. Any hospital that does offer sex-rejecting procedures to vulnerable populations of pediatric-age kids will no longer be able to participate in the Medicare and Medicaid program. We want our hospitals returning to healing, not harming the patients entrusted with their care, or they're going to pay a very steep price. These actions are part of an all-government effort led by President Trump and spearheaded by Secretary Kennedy to protect vulnerable individuals and genuinely make America healthy again. This is not just smart, science-based health policy. It is our moral duty, as Senator Humphrey mentioned 50 years ago. I'm passionate about this issue. My whole team is passionate about this issue. Secretary Kennedy, God bless you for pushing forward on this.